Our next witness would, I understand, wish to be known as Colette.
That's right, sir. Colette Wintle.
Please state your full name.
My name is Colette Marie Wintle.
And repeat after me. I do solemnly, sincerely and truly declare
sincerely and truly declare
and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Colette, you're a symptomatic carrier of haemophilia A. Can you tell us what that means?
Well, females generally have in the past been understood to be carriers of the defective gene factor VIII. But in my family, that has not been the case, that many of the women in my family have been symptomatic of the condition as well. And there are other bleeding disorders that have come into play that have been discovered later, as has happened in my case. So I'm not just symptomatic of haemophilia A, but I also have factor XI deficiency as well.
And the factor XI deficiency was diagnosed in the mid-90s?
Yes.
In terms of being a symptomatic carrier of haemophilia A, can you tell us how that was diagnosed and how the symptoms, whether of that or that combined with the factor XI bleeding disorder, have manifested themselves over the years?
I was diagnosed at the age of 3. My mother was known to the professor of haematology who established the Haemophilia Centre in the Glasgow Royal. And when my mother started a family, he asked that, her children be brought in so that he could test. I am one of twins. I have a brother and an older sister. So in 1962, Professor Douglas, as he was known, tested both my sister and myself. Didn't expect to find it in my brother, and of course did not. But we were found to be carrying haemophilia A. But the difference was that as I was growing up, I was much more like my mother in the way that I demonstrated that symptomatic behaviour in terms of bleeding pattern. So I bled every day from my nose all the way into adulthood. I had spontaneous bleeds into muscle and tissue, small joint bleeds, I still do, and have had some serious internal bleeds. And it's had a huge impact on my life. I can't really remember a period of time where I've not been going to hospital for something, and it's involved the bleeding aspect, yeah.
And in your teens, by the time you got to the age of 16, you were severely anemic. That affected your schooling.
Yes.
And you've continued to experience bleeds over the years.
Yes, that's right.
You were first given factor VIII products,
yes,
in 1976 when you were 17 years old.
Mm-hmm.
Can you tell us about the circumstances in which you were given those products?
Yes. From a very young age, I think the age of 3, I suffered from chronic throat infections. And my mother's doctor in the early days did not want, I should have had my tonsils out when I was small. And because there was there was a risk. He knew that there was a risk because my mother had, was a problem herself with the bleeding, and they were terrified that, that I would have an issue. So it was put off. And eventually, I lost a lot of schooling because I was constantly off with tonsillitis and throat infections, etc., and sore ears, and etc. And so it was decided that they would take the tonsils out. So I was still a minor in those days, so obviously it was my parents that would have been talking to the doctors about it. My parents were never counselled by the doctors on what type of clotting products that they would use if I bled. So there was no informed consent on what they would use. And it's interesting that laterally, years after this has happened, and I sought to get my records from the Glasgow Trusts, which was a hell of a fight to get them, I discovered a slip of paper demonstrating clearly that the intention from the haematologist at the time was that I would be given cryoprecipitate. Someone put a line through that and put factor 8, but they didn't sign that letter to say why they had chosen to change that course of treatment.
And we could have a look at that document. It's 1056003, please, Paul. And if we could just thank you. So this patient is we've got the date 10th of June 76. This patient is a haemophiliac carrier and has been given, and as you say, cryoprecipitate is crossed out and factor 8 concentrate handwritten over by the haematology staff, aftercare routine plus, and then again it's crossed out and we have factor 8 written over that, the latter under the direction of the haematology department, etc. And you've subsequently discovered the particular factor product that you were given in 1976. And what were they?
Haemophil, and I think Propylate was the other one.
Now, you've said you don't think your parents received proper counselling about the nature of the products. As far as you're aware, were your parents told anything at all about any risks of infection associated with such products?
No, not at all. In fact, my mother expressed shock years later after I discovered what I'd actually been given. She said, I had no idea. I assumed that what you would be given was British products. The idea that, I was being injected with blood products, which we now know were 100% risk of hepatitis, and the source from where they came, which was disgusting. And it would have absolutely broken the protocol of how we collected blood in this country. Why on earth would you go to the United States where the wrong type of person is attracted because they are paid for their blood, when you have a system in the UK here where it's a gift? So it blows my mind that any doctor, would be happy to take that risk. And I'm afraid to say that I know that by 1976 it was quite evident that the knowledge of that had been there for some years of what those risks were, but they most certainly were not imparted to my parents. And of course I was a minor, so I had no opportunity of discussion at all.
And there was a comment a doctor made to your mother on the day you were discharged from hospital, which has resonated over the years with you and prior to her death with your mother. What was that?
Yes, I'd had a pretty traumatic month of being in hospital. I lost a tremendous amount of blood. I hemorrhaged very, very badly. Very poor nursing, I have to say, post-surgery. It was a nurse on the ward insisted that I swallow down large lumps of meat, and they tore the clots away from the back of my throat. And, I actually almost died. The priest was called and I was given the last rites. I had the curtains drawn round me for a whole week because they were just expecting me to pass. I just couldn't stop hemorrhaging. I did recover, and on the day that I was discharged, the doctor came to see my mother, and he said to my mother, I'm glad that Colette's finally recovered and she's going home, but your daughter will never be the same again. That, for me, knowing what I know now, was quite a significant thing to say. My mother, sadly, didn't question it, but those were the days of the doctor's paternalistic attitude. You didn't question them. The white coat knew everything, and you just didn't question. So my parents, my mother particularly, because she was the one that, obviously was looking after me, and my father was at work, so he wouldn't come in and question, but my mother was very upset for years after that and regretted not questioning.
You didn't receive any further blood products between 1976 and 1982 following the treatment you've just described, although you did have bleeding episodes
Yes.
during that time.
Yeah, I did. I actually, At one point, I bled for several days from a duodenal ulcer. I did suffer, well, as I said, I never stopped having daily nosebleeds, and they could stretch up to several hours, but I was never offered any treatment or encouraged to come in and have treatment.
In that period, those 5 or 6 years before we get to what happened in 1982, what, if anything, do you recall about how you were feeling and your physical health generally?
Well, it took me a long time to recover from all that blood loss and, physically drained. I dropped down to 6.5 stone. Took me a very long time, but the one thing that never was right again was my levels of energy. I would describe it as sort of almost permanent malaise. And as a young woman, 17 and growing into, future adulthood, it's a time of your life when you expect to be full of energy and, bouncing around. I used to sleep for hours. I remember on one occasion, I think I slept solidly for 24 hours. My mother kept coming in to try and get me awake, and I just would drift off again. I was exhausted all the time.
Now, by 1982, you'd moved to Kent, and you were either about to start or had started training as a nurse.
Yes.
And you were treated in Kent, in Tunbridge Wells, again with blood products, factor products. What can you recall about that? What was the intervention and what happened?
I had developed quite, marked pain in my back, and I had terrible sciatica down one side of my body, and they identified I had scoliosis, but also I must have had a trapped nerve, and it was decided that the course of action to get me sort of back into my training was to do a spinal manipulation under general anaesthetic, and the cover for that would be DDAVP. The advice, as I understand it from letters that I've now seen laterally, to my GP and I think Dr. Townsend, who was the orthopaedic surgeon who was doing the job, would be that he would liaise with Dr. Taylor at Pembury Hospital, which was the nearest hospital. And although I think at that point I was registered at the Royal Free, but they were sending the advice down to the local hospital. And it was quite clear in that letter that I was supposed to be given a safe, well, I know now would have been a safer blood product.
What blood products were you in fact given in the course of this surgery in 1982?
I was given factor VIII.
And you've subsequently ascertained, and we'll come on later to subsequent meetings you had with the doctor in question, but you've subsequently ascertained that it was probably factor VIII products from a pharmaceutical company called Immuno.
Yes.
On this occasion, in 1982, were you advised now as an adult or informed about any risks of infection or involved in any discussions with the doctor about different products?
No. In fact, what actually happened was, as often happens with mild haemophiliacs, because they're not treated prophylactically, they don't have bottles in front of them with warnings or labels or anything. What you're presented with is the syringe with the already made up product ready to inject into your arm. So there's nothing, to say that there's any risk there. So there was nothing evident for me, and most certainly there was no discussion. He simply turned up and said, "This is your clotting products," and they were injected, and that was it.
Now, after you'd had those products in 1982, in the period 1982-1983, you began to feel very unwell, and you went to see the GP, or indeed, yes, I think more than one GP. Yes. What kind of illness were you, or symptoms were you experiencing, and what reactions did you get from the GPs?
I was starting to lose weight rapidly. My colour was odd. I felt highly nauseous. Just smelling food made me feel sick. I had no energy. I just generally felt really, really bad. And that's why I consulted with the GP. At that point, I was working on a surgical ward. And I was struggling to get through the day. And so I knew that there was something not right. So I consulted with 2 GPs, and their attitude was, I think you might be just imagining the symptoms of some of your patients that you're nursing. Pretty appalling thing to say. No, I wasn't imagining the physical evidence, and also I was saying to them, well, look, my urine's really dark. That's not right. And I just feel terrible, and I feel sick. I want to be sick all the time. No investigations, no follow-up, nothing. On this one particular day, I just simply couldn't get up and go to work, and my sister said, I'm going to call the GP out. So she called the GP out, and he did the same thing, completely dismissive, didn't ask about any history or, why that this might be happening, and just said, she's fine, she can go back to work, there's nothing wrong with her.
Now, you did go back to work,
yeah,
as a nurse,
mm-hmm.
And there came a point in 1983 when you were diagnosed with hepatitis B, but not by your GP or via the GP route. Can you tell us how that diagnosis came about?
Yes. This particular day, I had been left to draw up various injections and drugs for the next drug round that was going to happen in the afternoon. Sister had gone off the ward and left me to do that. And I can remember, it was an old-fashioned hospital, and I can remember the old china sinks that they had, hanging over it, thinking, oh, God, I'm just not going to get through this. I don't know how I'm going to keep going, but I have to do this. And just at the point where I was standing doing that, across the doorway came a lovely chap. He's now an eminent liver surgeon at King's, but he was a registrar in those days, called Nigel Heaton, lovely chap. And he came past, and then he walked backwards, and he looked at me. And he said, Colette, can I have a word? He said, come here. So anyway, I went and spoke to him. And he said, just turn around and look at me. He said, do you know you're jaundiced? And he said, how do you feel? I said, I've been feeling terrible. He said, why haven't you been to a doctor? I said, I have 3 times. I've consulted with a GP. And he just shook his head, and he said, without knowing it, he said, I think you've got hepatitis. He said, you look dreadful. He said, you are jaundiced. So he said, look, stop what you're doing. I said, I'll get into terrible trouble. Because the sister that I worked for, she was an old tartar of an Irish sister, and you didn't dare cross her or not do your job, because she'd be on you. But he said, I'll deal with her. He said, you go off and do what you know to do. He said, you know how to test the bilirubin in your urine. He said, do that. Meet me on the other ward next door, a female surgical. And he said, I'll take a sample of your blood, but I won't send it locally. I'll send it off to London. And he did. And he said, and because I used to wear the nurse's cape in those days, get your cape and go home. He said, you shouldn't be on this ward. You're not well. And don't come back until I tell you. So I said, okay. So I went home and told my sister, and she said, oh, my Lord. She said, I knew there was something wrong with you. Okay. So we waited a week, and he phoned me at home and said, I'm sorry to tell you, Colette, but he said, you have got hepatitis B, and you can't come back to work. So I then had to phone up and discuss this with my training tutor, and as soon as the hospital found out, they couldn't wait to get rid of me. And I asked about if I get over this and I'm well enough, can I come back and finish my training? And I was told no.
Can you recall what, if any, treatment you received for the hepatitis B at that point in time?
None.
And what impact did that attack of hepatitis B have on you at the time? Obviously, you weren't able or weren't permitted to go back to work. How else generally do you recall feeling?
Desperately ill for a long time. In fact, I was ill with that hepatitis for a further 2 years, and I wasn't able to return to work until 1985, and I was reliant on my sister keeping me living with her and looking after me, and she was a young mum and struggling herself because she actually had also been infected the same year, earlier that year, after her first baby was born. So there you had two of us infected from the same hospital by the same doctor, and neither of us had any follow-up.
Now, I'm going to ask you to look at a letter. Could we have up on screen, please? 1056010. And you'll see, Colette, this is a letter dated the 22nd of February 1984, and it's from the Royal Free, from Professor Kernoff, consultant haematologist, to your GP, and it's about you and your sister. Is that right?
Mm-hmm.
When did you first see this letter?
This morning.
And you've asked for your medical records over the years on a number of occasions from the Royal Free, is that right?
Yes, I actually had to write not once but 3 times to the chief executive to complain, because they would send out parts of my records. Interestingly, and most haemophiliacs will connect with this, general records are kept in a separate part of the hospital, but the blood treatment records are kept in the haemophilia centres, so they're separated. So they have complete control over them. So when I requested my full records, I was getting them in portions, bits here and bits there. But that letter, that's the first time I've seen that, it's today. I've never seen that before. But that makes it all the worse, that first sentence there, because as I read it, it's quite obvious they were aware of the risks of using commercial products.
And just for the sake of clarity, this is a letter supplied to the inquiry by the Royal Free and shown by the inquiry to you.
Yeah.
And if we just look at it, it refers to a phone conversation on the 20th of February of that year, and then it says this: because of the risk of hepatitis after transfusion of factor VIII concentrate being very high in infrequently treated patients, we try to minimise blood product exposure when treatment is needed to prevent or stop bleeding. Just pausing there. Colette, were you ever told at the time, 1983, 1984, that there was a very high risk of hepatitis for infrequently treated patients such as yourself if factor VIII products were used?
No, never. And this makes it all the more horrific because exactly a year later, the Royal Free reinfected me with hepatitis C.
We'll come on to that.
Yeah.
The letter continues, DDAVP injection has proved to be very useful in this respect, and goes on to explain why. And then in the last sentence of that paragraph, if DDAVP fails or a major elective procedure is to be undertaken, we would prefer cryoprecipitate to factor VIII concentrate because the former is prepared from the plasma of many less donors.
But the other thing which it notes is that you have what it describes as only mildly depressed factor VIII levels.
Interesting, because my factor VIII levels started off in single figures as a child. At the point that they were talking about mildly depressed, it might have been 23%. And it's gradually come up over the years. It still floats below 50. But of course also I had factor 11 that hadn't been diagnosed at that point, which didn't help, so it made things worse when I had a bleed. But yeah, they would often describe it as mildly depressed, and of course they still held the attitude in those days that I was just a carrier.
Now, were you told anything at all at the time about the availability of DDAVP?
I don't honestly recall. I was mildly aware of the fact that the DDAVP was mentioned, but there weren't any discussions.
Was there any discussion with you about there being this hierarchy of treatment, and for you or your sister, ideal was DDAVP? If that failed or there was to be a major procedure, cryoprecipitate, and only if those two were unavailable, effectively factor 8. Was that discussion ever held with you?
No, because if it had have been, then I would have been aware that there was risks involved in this treatment, and that I wasn't aware of the risks of the at that stage, no.
And if we then just look at the next paragraph, there's a reference to a number of the professor's patients with mild factor 8 deficiency being treated by GPs with DDAVP, and that's suggested as for the GP to consider as a practical proposition. And then if we go over the page, please, Paul, we'll see, thank you, the second paragraph on that page, Colette, we'll see the professor saying, if you had problems in obtaining supplies of DDAVP, I should be willing to give you and your sister a limited supply to keep at home. And then there's reference to record sheets being completed for the purpose of national data being collected, the view being expressed there that we're interested in assessing the blood product saving impact of DDAVP. Do you recall whether at this time, 1984, you or your sister were given a supply of DDAVP at home?
No.
No, you don't recall, or no, you weren't given?
No, we weren't given a supply, no.
Were you given, seems unlikely if you weren't given the DDAVP, but was anything told to you about record sheets or the collection of national data or assessment of the impact of DDAVP? No. And then if we have the last paragraph, please, Paul, first sentence. It says this: if treatment with DDAVP is unsuccessful, blood product therapy may be indicated, and I think it's important, again, for you and your sister to appreciate this. Were there discussions with you about the potential for future need for blood product therapy?
I mean, it seems quite incredible to me that this advice and suggestion of treatment, etc., and Dr. Taylor would be established with the local hospital and Dr. Taylor. Dr. Taylor, not only did he not impart to me when he was busy injecting the commercial product into me, not only did he not impart to me the risks of what he was doing, but he also failed to tell my sister in the earlier part of that year, and in fact, he refused to see her in clinic. She twice tried to get an appointment to see him, and she was rebuffed. She then approached him because she was nursing in the other hospital that was linked to the one I was working in. She actually approached him on the ward twice and said, I need to speak with you. And he rebuffed her again and actually told her off for being unprofessional in approaching him, whilst on the ward, and, see me in my clinic. And she said, I've tried twice and I can't get an appointment with you. So the communication level was utterly disgraceful. And, when I think about the way she was treated, the obstetrician, when my sister was rushed back into hospital after a massive hemorrhage, actually stood at the end of her bed and said, people like you shouldn't be allowed to have children. So you can see the level of contempt that we're talking about. So all this letter would suggest that there's some great communication going on and advice. No, that's not the case.
So you've said none of this was imparted to you by Dr. Taylor. It's a letter between the Royal Free and your GP. Was any of this information shared with you by your GP or by the Royal Free Hospital?
No.
Now that's 1984. In 1985, you were given treatment again for a third time with factor 8 products.
Yes.
And where was that treatment given?
The Royal Free.
And you were given treatment with factor 8 made, as you understand it, by Alpha Pharmaceutical. Were you given any options to have either cryoprecipitate or DDAVP instead?
No.
Were any of the matters set out in that letter discussed with you by the Royal Free at the time you were given this factor 8 treatment in 1985?
No. And really, it's quite appalling because they reinfected me with non-A, non-B, hepatitis C as it's now known. Not only did they infect me, but they didn't follow me up. They would have known using commercial factor on me was high risk. They've laid it out the year before. What's the safer option? So they know. So they knew what they were doing when they took that bottle off the shelf. I would suggest that they were using up old stock, as a lot of haemophiliacs had happened to them. And that's what they did. They took that off the shelf, knowing that there was high risk, and they used it on me. And that particular batch is registered in the American courts, because I went to America, and it was acknowledged in the American courts as a defective batch.
And one of the particular concerns you have about the fact that you were given commercial factor VIII products in 1985 was the state of knowledge by 1985 about, at the very least, the risk of HIV.
Absolutely. And that's what horrified me, because I realised that, they infected me with non-A, non-B, but it could have been HIV. I mean, for many haemophiliacs, they will know the pattern here. It's like a Russian roulette every time you're treated. And HIV was the only thing I wasn't exposed to. But I'm horrified that they did that to me in 85. And retrospectively, in the years of campaigning and researching and so on, that I can say, because it's in the public domain and it's in a published book called HIV the Myth, Dr. Charles Rizza, who was Oxford Haemophilia Centre Director, actually is in print saying, by the mid-70s and 80s, we knew all the products were infected. Why the hell did they use them then for a further 10 years?
Now,
it doesn't make sense.
Having been given those factor products in 1985, you remained a patient at the Royal Free Hospital, and in June 1987 you married your first husband, and in the early springtime of that year, prior to your first marriage, you and your husband Keith attended the Haemophilia Centre at the Royal Free for some advice and genetic counselling.
Yes.
What had particularly prompted your attendance on that occasion, and who did you see?
I'm pretty sure it was Eleanor Goldman, and the prompt was that we were getting married, we were going to live abroad, management of my haemophilia, and naturally genetic counselling, because we intended to have children. So I felt it was important for Keith to fully understand what the risks were if we had children. It's a 50-50 risk of passing on the haemophilia gene. Were I to need any haematological intervention or care, how we would go about setting up advice from England so that whoever was, looking after me potentially when we moved would know what they were doing. And that was the main purpose of going in. That's what was discussed.
And you and Keith were planning a move to Oman in the Middle East.
Yes.
Now, you said in your written evidence that there was discussion on the issue of you having had hepatitis B,
yes,
an episode from which you had recovered from,
mm-hmm.
and there were some particular discussions about hepatitis B and issues of immunisation. Is that right?
I hadn't. What they'd found was that I, despite having had it chronically for 2.5 years, I hadn't raised enough immunity to protect me from getting it again. So they needed to vaccinate me. So I had a series of 3 vaccinations so that, I could mount some form of level of protection within my body.
Was there any discussion with you at this meeting in 1987 with Dr. Goldman and Keith and yourself about what we now know as hepatitis C, what was then referred to as non-A, non-B hepatitis? Was there any discussion at all?
No. And retrospectively looking back now, again, the contemptuous attitude, because they actually placed us both, me particularly, but placed us both in grave danger, because you're not allowed to go to live in countries like Oman or the United Arab Emirates if you've got hepatitis. I don't know what the rules are now, but in those days, you would never have been allowed entry into that country. And if you were discovered to have it and hadn't declared it, it was a jailable offence. So nobody in their right mind would put themselves in that position in the first place. So obviously, if I had known I'd got chronic non-A, non-B, we wouldn't have been moving abroad. So I just can't believe that, they must have been aware of that. They must have known that you couldn't You couldn't go abroad and live in a country and not declare you got something like that.
Let's have a look at another document, Colette, 1056004. So this is a letter from the Royal Free, again to a GP, 20th of June 1985. And we'll see from the first paragraph, it refers to you having had bleeding episodes, it refers to you having been used factor 8 concentrates. And then if we go to the third paragraph, please, could we highlight the first 2 lines? So 20th of June 1985, your GP is being told by a professor at the Royal Free Hospital, I agree that this lady has chronic non-A, non-B hepatitis. This has presumably been transmitted from factor 8 concentrates. Were you told in 1985 that you had chronic non-A, non-B?
No. And actually, the first time I saw that letter was when I accessed, under Freedom of Information, my GP's files and records. And when I pulled that letter out, I couldn't believe my eyes, because they'd been communicating about a condition that I had not been informed of.
And that's, in terms of you first seeing this letter, that was a number of years later.
Yes, quite a number of years later.
But in 1985, you were not told that the view was that you had chronic non-A, non-B hepatitis.
No.
And moving forward to the meeting in spring of 1987 that you and the Royal Free and
just before you move forward, can we have a look at the rest of that paragraph? Is it saying that there is potential infectivity to any child that may be in the womb, and that has simply not been mentioned to Colette?
Well, Colette, if we look at this and you can assist us with your understanding of the letter, it says, it sets out the doctor's view that the non-A, non-B hepatitis is only mild. You suspect the prognosis is good. No contraindication to pregnancy. At the present time, we do not know whether the virus will be transmitted to the neonate. The amount of non-A and non-B virus in the blood is much lower than with the hepatitis B virus. For this reason, the level of infectivity to the infant should be lower. It doesn't say non-existent. I have not mentioned this aspect of the problem to her.
There you are.
And was there ever any discussion of any of these concerns or issues with you?
No.
Thank you, sir. That's 1985. And then moving forward to the 1987, when you were having this counselling session with your then future husband Keith and Dr. Goldman, was the information that had been set out in this letter 2 years previously by the Royal Free shared with you at that stage in 1987?
No, not at all.
And as you've said, you had a particular concern, you and Keith, about the fact that this wasn't disclosed because you were going to Oman for the reasons you've explained.
Well, I went to live in Oman. What happened was that we went out to Oman. I was there for 3 months. And then my husband was asked to go and establish a publishing house in the United Arab Emirates. So I had to come back home, and then a residency application had to be put in before I then went back out to the UAE.
Now, you'd expressly requested a medical letter to whom it might concern.
Yeah.
And the purpose of which was, if you became ill whilst away, you would show the letter to any doctor who was treating you. Is that right? And we should just look at that letter, Colette. It's 1056005. We see it's 18th of September 1987, to whom it may concern. It's a letter signed by Dr. Eleanor Goldman. And we should just look at the second paragraph of the letter, please, Paul. We could just highlight that second paragraph, thank you. You'll see there, Colette, it refers to the events of 1976. It refers to treatment with factor 8, it says there in 1983, followed by an acute attack of hepatitis B. And then it says liver function tests remained mildly abnormal afterwards. You remained Hep B negative since February 1984 when she came under the care of the Royal Free Hospital. And then it says this, she had a further attack of hepatitis, probably non-A, non-B in 1985. Now, do you recall whether this letter was given to you at the time, I think, to take with you? Is that right?
Yes, it was a protective letter, and really it was just to say she's had hepatitis B, recovered from it. And I didn't actually pick up on that particular bit because I didn't know what she was talking about. I wished I should have questioned it. I didn't know what she was talking about. But the idea is it was probably non-A, non-B. Well, blimey, I mean, they should have known because they knew they'd given me an infected batch off their shelf. And I think the reason that they didn't explore that with me is because they would have had to explain why they did that to me, having the year previously set out what was the safest treatment.
So this is expressed as being you had in the past this further attack of hepatitis in 1985, described as probably non-A, non-B. Did you pick up at all on the significance, if any, of the reference to non-A, non-B?
No.
Did you understand this to be communicating to you that, in fact, they thought you had chronic non-A, non-B?
No.
And I think
if I had, then surely they would have been following me up, and surely they would have referred me to a hepatologist. That didn't happen.
We've actually got a letter from your first husband for the purposes of the inquiry. It's 1056009. And it's the last 3 paragraphs on that page. Keith says he confirms that at no time was it ever mentioned to us during our counselling sessions that Colette was infected with the hepatitis C virus. Pausing there, it was then known as non-A, non-B, but again, for the avoidance of doubt, as I understand your evidence, it wasn't mentioned as non-A, non-B either.
No.
And then reference to, in the bottom of the page, had I/we been informed, I would never have put Colette's life and freedom at risk by moving to the United Arab Emirates. And over the page, he explains why that would have been particularly problematic.
Yeah.
It's top of the next page, please, Paul. Thanks. Because having such a condition would have been exceptionally difficult to treat in the UAE, and having it as an expatriate resident could have led to serious legal consequences.
Yeah, exactly.
Now, in 1991, by which time you met your current husband, Stephen, who sits beside you, and you were intending to get married in the course of 1991.
Yes.
Is it right that at some point in the first half of 1991, you and Stephen had a counselling session at the Royal Free?
Correct.
And was that again for similar purposes?
Absolutely, yes.
And with Dr. Goldman again?
Yeah.
Was anything said to you in the course of that counselling session, attended by you, Stephen, and Dr. Goldman, about chronic non-A, non-B or chronic hepatitis C?
Never mentioned.
Non-A, non-B mentioned at all?
Never mentioned.
Hepatitis C mentioned at all?
Never mentioned.
When did you discover that you had been diagnosed with hepatitis C?
Months after I got married to Steve. They'd called us into the clinic, we'd had this session, and they saw me 2 weeks before we got married in clinic at the Royal Free, and there was not one single mention of hepatitis C. They obviously, as routine, when you go to the centre, they inevitably always take blood samples from you while you're in there, and clearly they would have done that and probably, doing what they normally do with them, testing them, looking at your clotting levels. That's what I assumed that they were doing, was looking at my clotting levels. But it's evident that several months after that happened, several months after we were married, they called us back into the clinic to deliver the news that I'd got hepatitis C.
And Stephen has also given a statement to the inquiry, and in that he said At no point during this counselling session was there any reference or mention of Colette's hepatitis status. Shockingly, it was several months after our marriage, but in the same year, 1991, that we were informed by the Haemophilia Centre that Colette was positive for hepatitis C. So, having been told finally in late 1991 that you had hepatitis C, what information was provided to you about that condition?
It was tremendously played down. I was told not to worry about it at all. It's just like having bad flu, really. And I remember thinking, well, this doesn't feel too, good, if it's flu. Because, the classic symptoms are, bone ache, muscle ache, fatigue, all of that. Of course, when you put all that together, it then starts to make sense. And when you connect it back over the episodes, and then when I think back even to 76, when I didn't feel right, even though I'd supposedly recovered from that dreadful episode, it made sense, that terrible fatigue. There's nothing quite like it. It was quite devastating, really, wasn't it, to find that out, and also that laterally the knowledge of what was in my records and what was known, but it hadn't been imparted to me, to us, or the risks. It was just like, it's okay, it's just a bad flu, you'll be all right, not the devastating consequences of what it was doing to my liver. And obviously, retrospectively looking back, how long my body had been under attack from hepatitis virus, literally from the age of 17.
Now, you underwent your first course of treatment for hepatitis C in about 1999. 1999. And what was that treatment and what was it like?
Oh. It was ribavirin and interferon. I have never felt so ill in all my life. It was like being here in this world but not being here. It was quite surreal. I was in curled up pain. I had pain all through my spine, literally all through my body. My muscles were aching. I would frequently pass out on the couch and be out for several hours. I felt sick, and as we hear quite regularly now, I had huge hair fallout. Now, I was fortunate to be blessed with a massive head of hair, and thank God I had some to lose. But it was quite horrific because it came out in great big clumps. So, if I had a bath, it was floating in the bath. It was in bed, I'd wake up, it was on the pillow. It was lying on the carpet, it was just everywhere. And most women will relate to this, your hair is, very much a sense of being feminine, making you feel nice about yourself. When your hair drops out like that, it's horrible, really horrible. There was one occasion I know that Steve was terrified because he came home from work to find me laid, sprawled on the couch, completely out of it. And he said he thought I'd died because my colour, I was of a strange colour, wasn't I? And he was terrified. And I have to say that I could only manage to do 4.5 months of that treatment because I was having to self-inject and take tablets. And the side effects of that were horrendous. I couldn't taste my food. I wasn't particularly hungry. The weight dropped off me, and and the side effects of it. But the fatigue was probably the worst. And of course, I was a young mother. My daughter was starting school. I was struggling to cope. And the year prior to that, because I had continued to try to work, but I had reached a point where the hepatitis was affecting me so badly. And ironically, I was nursing for the NHS in my last role, and I was forced to retire. I just couldn't continue. They wanted to get rid of me, and I said, look, if you're going to do that, then you retire me on health grounds. I'm not just walking away from my job. It's not my fault that I'm sick, but they said you can't continue as you are. I was working with the district nursing team at the time. It was night duty, and I used to cover something like 400 square miles, so it was quite a demanding job. And I had to retire that year.
And in your written statement, you talked about the treatment in 1999. The side effects were many and too awful to bear. You've referred to the hair loss, but also peripheral damage to the blood vessels in my
Yes.
legs, numbing of the lower limbs,
Yeah.
loss of appetite, and physical pain all over my body, which
Yeah.
was indescribable.
Yeah, and I still have to this day. It was interesting. Both the back of my legs, it was obvious that the treatment was damaging the blood vessels. So all the peripheral blood vessels were all ruptured. So I had sort of purpley red and black all down the back of my calves, and I lost sensation in my toes and my lower limbs. And that went on for quite some time. It took a long time to recover from that. That rash stayed there for about 2 or 3 years.
So that treatment you weren't able to complete.
No.
You didn't clear the virus, and you continued to experience the physical and mental
Yes.
symptoms of hepatitis C.
Yes.
Now, you've talked in your witness statement about a meeting that you had in 2002 with Dr. Taylor, who'd been the doctor in 1982 in Kent who'd given you the Factor VIII products. And one of the purposes of the meeting was you wanted to get the batch numbers for the products.
Yeah.
And what was, in your recollection, Dr. Taylor's response?
Well, initially, I obviously had to sign a form requesting my records, which I duly did, and I was sent a small sheaf of general records where it referred to, the fact that I'd been in hospital, I'd had treatment, and there was even, I think there was even a recorded batch of normal saline, but no blood batch records of Factor VIII. So I contacted the hospital again and said, these records are incomplete. Where are the blood records for my treatment in 1982, December 82? Well, there aren't any. And I said, well, that can't be right. There must be. Because the thing is, with the condition of haemophilia, it's a lifelong condition. And therefore, any treatment that you have had has to be kept. For the reasons being that people get adverse clinical reaction to some treatments, they might develop prohibitors. So you keep those records, they have to be kept. And he said there are none. They've been destroyed. And I said, well, you should know that those particular records should never have been destroyed for the reasons that I'm just telling you. So I insisted upon a meeting, and I set out, I think, a dozen questions in advance, and I sent that in the post and said, I'm giving you an opportunity to answer these questions because I was really concerned about his attitude. I didn't like his cavalier attitude anyway, but I thought I'm going to have to confront him. So we set up a meeting, and I took with me a lady from the Community Health Council, which was the last independent patient advocate. And Steve came along with me. And he amazingly developed quite a lot of amnesia throughout that meeting. He didn't answer the questions as I'd asked them, and he'd had plenty of opportunity to, think about it and give me a good response. And I had to force out of him where he was purchasing his products from and who was purchasing them and where the purchasing records were for those blood products, none of which he could provide.
And the answer in terms of where he was purchasing them from or where the hospital was purchasing them from was a company called Immuno. Your understanding is that they purchased or sourced their products from the States. Now, did you have any conversation with Dr. Taylor in the course of that meeting about what information he had or hadn't given you prior to the procedure?
Yes. I wanted to establish what his state of knowledge was with regards to the risks of commercial plasma. And he confirmed to me that he was very well aware of the risks involved. I thought, well, that's very interesting. So why was I not consulted on them? So I said to him, well, that's okay, interesting, because I don't recall at any stage you meeting with me and having a discussion about this, or warning me before you gave me these blood products, by the way, there could be a risk here of hepatitis. And he sat there and he stared into the distance. Ah, well, he said, it was a mere oversight, I forgot to tell you. I said, what? A life-threatening disease, filthy commercial blood products, and you thought, so just an oversight, you forgot to tell me, you thought that was okay. And his attitude was, very cavalier, wasn't bothered in the slightest.
And you know, I think that Dr. Taylor's provided a statement to the inquiry and some documents attached. You've not had very much opportunity in terms of time to look at those, and you want to be able to look at those and, if necessary, provide a written response.
Yes, I do.
The other thing that then came to your attention in 2004 was an issue about the risk of exposure to VCJD. Mm-hmm. Now, you'd been treated in 1993 by, your statement says, a blood plasma batch made by BPL, and you became aware later from news reports about BSE and CJD, you became aware of those issues and you wanted to raise it with the Haemophilia Centre at the Royal Free.
Yes.
What happened?
Well, I was very concerned when I saw, I thought, not another pathogen, surely to God. So I phoned them up and said, have I been exposed to new variant CJD? And I was met with a very dismissive attitude and told to stop worrying and fretting about it. No. The answer was no. Well, 1993, just to say, I was actually in hospital for quite a protracted period of time. I was actually in for 3 months. And I had three operations during that time to remove a tumour. And the surgeon made a mess of it each time. But anyway, it was obviously during that period of time that this product would have been used. And then some years later, obviously, there was questions being raised in media reports that, there was a possibility of this, so that was why I was questioning, and was told categorically, no, you're fretting about nothing unnecessarily. So, off you go. Clearly, that's not been recorded, because there's no record in my notes, but that conversation was had, because I remember discussing it with my sister and saying, I'm really terrified that here we go again, this is something else. That, and I said, knowing my luck, I probably have been exposed to it.
And in 2004, November 2004, if we have up on screen, please, Paul, 1056006, you received this letter from the Queen Elizabeth Hospital, Birmingham, where you'd moved and your care had been transferred there by this time.
Yeah.
It says this, Dear Colette, following your recent outpatient clinic appointment, I wrote to Christine Lee with regard to the variant CJD exposure situation and have had a reply today from her. As per the instruction of the patient reply sheet that you returned to them, I'm writing to let you know that you did receive UK-sourced factor VIII concentrate between 1980 and 2001, and that in 1993 you received a quantity of factor VIII from a batch that had been contributed to by a donor who subsequently went on to develop variant CJD. And then there's a reference to the possibility of arranging a date to discuss it further.
Yeah.
What was the impact on you of receiving that communication?
I was horrified, absolutely horrified and bloody angry, because I asked them, tell me, have I been exposed? And I was told no. And I actually asked Jonathan Wild to contact Christine Lee, because my gut was telling me differently. And when that answer came back, I was furious, because if you look at the time gap between 93 and when I was actually informed, it's 10 years gap. But worse still, I actually had to get to the nitty-gritty of exactly what had happened. I had to write myself, and I have a set of communications between me and the CJD surveillance team in Edinburgh to actually get the batch number and find out about the person who donated the blood, how long they were ill with the disease, and, from the point that they donated the blood to the point they were diagnosed and then subsequently died. So that information wasn't freely given to me. I had to go seeking that information.
And do you recall whether there were any further discussions between you and whether it's Dr. Wilde or anybody else about those issues?
No. And in fact, further to that, I was still suffering from quite severe nosebleeds and had to be treated. I had to have my nose cauterised for the umpteenth time. And of course, it occurred to me, well, what guidelines are being given to different departments in the hospital if they're faced with a patient like me who's discovered that they've been exposed to new variant CJD? What happens to the equipment? How is it autoclaved? Is it thrown away? If I need an endoscopy, will that equipment be reused, or, for the purposes of trying to avoid infecting others, will it be thrown away? And I was talking to the doctor as he was, trying to stop my nose from bleeding, and he said, we haven't got any such guidelines. And I said, well, why not? Because by then, should have had them. He said they haven't been handed out to us. He said, I've got no idea what the protocol is here. So again, I'm having to push for answers and ask the questions.
Now, you've set out very clearly in your written statement, and you've set it out again in your oral evidence, your understanding and belief that neither your parents originally nor you were put in a position to give informed consent to the use of blood products because you weren't given the requisite information. You also say in your statement that you have found in your medical records evidence that at the Royal Free you were tested without your knowledge or consent for hepatitis G. And if we just have on screen 1056008, that's a test result there recorded that you found this in your records.
I found it in my records, no date attached, yes, 1995, but no reference to who ordered the test, why they ordered it, and certainly no discussion with me as to why they were testing for hepatitis G. There is nothing in my records to identify who was behind that and why.
And as far as you're concerned, you were not asked to give that consent and did not give it?
No.
And was the result negative, one that was ever communicated to you as far as you know? Now, in terms of issues about obtaining medical records, you've described the position in relation to the Royal Free, you've described the position in relation to the hospital in Kent and Dr. Taylor. You also set out in your witness statement that you had some difficulties obtaining your Scottish health records from the Glasgow Royal Infirmary. Is that right?
Yeah, huge problems. Again, I had to write to the head of the trusts and complain that the records were incomplete. Where were the blood batch records? I explained the exact dates of when I was admitted, how long I was in hospital for, all the address details and my maiden name, hospital number, the exact dates during which I believed I was treated, and where were those records? Well, couldn't produce no, they don't exist. I said, no, they will exist. I want them. Effectively, what I had to do in the end, and again, it was force, through my campaigning, I've done a lot of stuff with media, and at that time I was working with Sarah Smith, who was working for, I think, Channel 4 then, and I had to threaten them with turning up at the hospital gates with the cameras rolling, and I said, make no mistake, I will not miss and hit the wall. I said, you produce those records, or I'm going to embarrass this hospital, so find them. And lo and behold, they miraculously turned up. Found on a microfiche somewhere outside of the hospital and had been moved, but they existed, where I'd been told, oh, they're 26 years old, they don't exist. Well, they did, yeah.
Now, I'd like to ask you some questions, Colette, about the impact upon you and your family of your infection with hepatitis C and consequent treatments for that. You In terms of your family circumstances, you said you've got your husband, Steve, and you have a daughter now in her 20s. And in your witness statement, you've said the impact of my chronic ill health has had a very negative and damaging effect on our family life. Could you elaborate upon that?
Yes. For the majority of my daughter's younger years, I couldn't be the mum that I needed to be for her. I couldn't join in on family events because I was too ill. Invariably struggling to get out of bed every day with fatigue and trying to cover it up from my daughter as well, because I didn't think it was fair for a little person to have the worry of mummy not being well and potentially mummy getting sick, maybe mummy dying. Trying to be a wife to my husband who had, a blossoming career, and, he's trying to keep hearth and home together. He's terrified, to leave me, can't support me in the way he'd like to, but it stole time from him too. And he felt like a lone parent for a long time. I'm sure that Steve will maybe make a comment about that, but it must have been horrible for him, living with that fear, me living with the fear, and of course, the other thing that I didn't mention was, I was suffering from depression as well.
Wanted to ask you about the effect on your mental well-being. Yeah. You've talked about in your statement about everything having had a huge effect on your mental well-being. It's caused you anger. It's caused you in the past to contemplate suicide.
Yes.
And you say in your statement that you almost carried out that desperate act a few years ago, but you realised you would leave behind unresolved grief and anger, which would have been hellish for your family.
Yes, that's true. I had reached probably the lowest I think I've ever been in my life. That's common, when you've got chronic condition like this, they want to put you on a variety of different tablets, and I do believe that the antidepressants that they put me on at the time probably actually made my mental state worse. And on this particular evening, I couldn't hack it anymore. I was in my night clothes and I ran from the house barefoot down a dark lane, because we live in rural countryside. I ran down that lane, tears streaming down my face. I still think about it now. I ran down there thinking how I need the courage to just put myself in there. There was a series of quite deep ponds that people go and fish. And I ran through that gate and headed for that pond, and I was covered in mud. It was wet, slippy, scratched by the bushes as I was running past and getting nearer and nearer, and I got to the edge of the pond and I put my foot in the water and thought, just get on with it, Colette. Just do it now, and then the pain will be over. Whether it was a guardian angel or something, there's another little voice sitting here saying, excuse me, what are you going to leave behind? A little girl who doesn't fully understand, what's happened to mum, and a husband who has been fantastic, supportive. He's been with me on this journey, and believe me, from when I started campaigning in '94, this man has walked across Westminster Bridge with banners. He's had T-shirts on him, Hep C, bloody murder, you name it. He's been to debates with me. He's been to Westminster, the Department of Health. There isn't a place that Steve hasn't. Downing Street, he's been with me all the way. And I couldn't do it. So I pulled back. They realised I disappeared and they were out looking for me, and eventually I went back and I sat on the bench outside of the house and I just wept. And yeah, they scooped me up, took me and washed me off and said, come on, pull yourself together, which was hard, very hard.
In terms of the physical impact of your infection, you've described powerfully that in general terms, the symptoms that you experienced over the years. You've told us about your 1999 treatment. You underwent a second course of treatment in 2015.
Yes.
How was that?
Dreadful. Terrible pain, terrible. I was very jaundiced for the first 2 months of the treatment. Skin was rashy and tingling. Again, fatigue just wiping me out. And this time my hair started to fall out, but uniformly rather than in clumps. And actually, it's only just stopped falling out. I had a big head of hair to lose, thankfully. And it looks like a normal head of hair to most people, but to me that's a quarter of what I had. But it's only just stopped coming out 4.5 years later.
It was only 4 months, wasn't it?
I was only on it for...
No, it was meant to be 4 months, wasn't it?
Yeah.
I said it needed to make
I did,
it 6
yeah,
months.
they made it 6 months instead of 4 months to try and clear the virus.
And the virus did clear in relation to that second course of treatment?
They say it's cleared. I'm not totally convinced that you really do get rid of hepatitis C. It's a very clever virus and it can hide. And the fact that they haven't got a test that can show it's well below 0, even sub-0, I think my level came down to something like 12. But I'm still feeling the effects. And I thought, maybe naively, I thought that, well, if I do this, because Dr. Mutimer, who's my hepatologist, was concerned that because of the length of time that I had been diagnosed with cirrhosis, which was 2004, by the way, that it was highly likely that I would be at high risk of going into liver failure, and I'm still very high risk of getting cancer. And actually, I haven't told you this, but in 2004, to ascertain the level of damage, I was asked if I would undergo a test which they do where they keep you awake, slightly sedated, and they cut your jugular and insert a wire all the way down through the major vessels until they get to the liver. They scan you beforehand so that they know where they want to go to look for cirrhotic material. And that was quite an experience.
Not
Being ex-medical, perhaps I got through it because I am fascinated by the workings of the human body. And so I decided that I would chat to the doctor who was doing it, very lovely man, Dr. Olaf, who was exceptionally nice and keeping me calm, because it is quite something to be awake and having somebody cut into your neck like it's a major artery. He was horrified that I wasn't anywhere near sleepy and kept saying, "Can you stop asking me questions?" But yeah, I had to go through that for them to actually decide this damage has gone to quite a level. And it was something actually that annoyed me because 2 years before I left Kent, I was not seen by anyone at the Royal Free. It was almost like they didn't want to see me. Yeah, perhaps because by then I was a seasoned campaigner and had plenty to say, and I suspect that they'd be uncomfortable for them for me to ask why they infected me in their department in 85, maybe, CJD lying about it, and they did lie.
And despite the treatment in 2005 having the effect that you've described, whether or not it's accurately described as clearing the virus.
That was 2014.
2014,
Yeah.
sorry. You have continued to experience a range of physical
Yes.
symptoms. You've described in your statement constant muscle and bone ache, chronic insomnia,
Yeah.
pain.
Yes.
You have a condition called costochondritis,
Yes.
which is inflammation of the cartilage connecting the ribs to the breastbone.
Yes.
You have fibromyalgia,
Yes.
arthritis in your joints, and very marked deterioration in the discs of your spine.
Yes.
In terms of dental care, you've been able to access that, is that right? But through a specialist clinic at the Queen Elizabeth Hospital in Birmingham.
Yes, it's done in the hospital. They have a clinic for haemophiliacs, and they invite you in either 6 monthly if you need it or annually for general care, dental care. So that luckily hasn't been an issue. But when I was living in Kent, I had to actively seek a dentist who was willing to treat someone with chronic hepatitis. And obviously I didn't know about the CJD exposure until I moved to the Midlands, but I'm sure that a lot of haemophiliacs have experienced, and I've heard them say they've experienced this problem. Yeah,
And you've talked.
dental care.
I'm sorry, Colette.
It's all right.
And you've talked about how, in your statement, how the conditions, the infections that you've had or have led in terms of treatment to you having to be operated on last, to being regarded as a dirty case, to there being a lack of knowledge on the part of the NHS staff who treat you often about the history of how these infections have come about. But you also said this, you're asked, or you have been asked on several occasions by NHS staff if your infections were due to lifestyle choices such as drug abuse or alcoholism.
Correct.
Is that right?
Yes, yes. That was said to me. I actually had to transfer my haematological care from Birmingham. I'm quite angry about this, but I presented on 2 occasions with an active bleed and was refused treatment, and I was deeply, deeply unhappy about that. But I think possibly because I'd had an exchange with Dr. Wilde, and he knew that I was an active campaigner and quite vocal on my criticisms of government, the NHS, the doctors that treated their haemophiliac patients in such a way of putting them at high risk. And I felt compromised, so I was forced to go to St Thomas's, which is quite a distance to travel. But on this particular occasion, I had to go and have pre-operative check-up before having a procedure done, and this lady was a trained sister, and I recall sitting down and the first thing out of her mouth was, so your chronic hepatitis C, is this down to your lifestyle choice of alcohol or drugs? I was horrified. It's been said to me when I have regular 6-monthly scans. Now, most of the staff have obviously got to know me, thankfully, now. But in the early days, you could see straight away, what was going through their mind, why she got cirrhosis of the liver. And you're constantly having to explain, and you're almost on the defence all the time, and anticipating every time you go into hospital and you're faced with medical staff, what they're going to surmise of how you came to be in this predicament. But I'm a great believer in education, and I've spent my entire life, since my knowledge of hepatitis came about, trying to make sure that the stigma that people have suffered, and actually it still does exist, that they wouldn't have an excuse if I told them and explained to them how it came about. And education's a great thing because it empowers people, and you're far more likely to not just educate them, but create in them an understanding and an empathy that maybe wouldn't be there because they wouldn't know about what's happened to people like me with a bleeding disorder who don't expect throughout their lifetime to be infected with multiple viruses over decades. It's just something people don't expect to hear. It's like a horror story, really, when you unfold it as to how things evolved over the last 3 decades and how I came to be in this predicament.
And one of the other things you've said in your statement is, having had to, as you've explained, take early retirement in 1998 and been unable to return to the workplace, you are often have to find yourself having to explain and justify the fact that you're unable to work, and have to reveal very private invitation to friends or people you might meet in social circumstances and elsewhere.
Yes, that's right. And there have been many occasions where, my husband's job involves quite a lot of corporate sort of entertainment, and as his wife, I go along to support him and, help him with customers and so on. And invariably the conversation will naturally come round to, so what do you do? And I have to say, well, no, I don't work. And they say, oh, very nice. And I'll say, no, you don't understand. It's not out of choice. I don't work because I can't work. and they look in amazement. Well, I suppose part of the problem is this facade, because you learn over time, if you paint your face and put a smile on your face, then to all intents and purposes, I look normal. And I guess we all want to look normal, don't we? We all want to be accepted by others and don't want to feel we're different. It's embarrassing at times to say, no, I don't. I had to retire when I was 38 years of age, and I won't work again, and then have to go into the detail. And then I feel guilty because on occasion Steve would say, could you not talk about it? And then you find, what am I going to say then? Why don't I work? Because I'm a lazy so-and-so. No, I'm not going to say that. And yeah, you do have to justify it. I told a funny story earlier. My daughter, the kids at school, how they talk. What does your mummy do? What does your daddy do? And so on. And Rebecca didn't find out really what the issues were with me until her early teens. But invariably, kids, would come have a sleepover and whatever, and they'd say, well, what does your mummy do for a living? What does she work at? And she would say, oh, mum's she just does dishes at home. Just does dishes at home. But mummy, meantime, is out there campaigning, trying to raise the profile of this damnable disaster. And she's coming home and saying, well, what's that camera doing in the garden, Mum? Or why are you going to the local radio station? Is that you in the paper? Eventually it started to unfold. But yeah, it's been pretty tough having to reveal those private aspects of my life and tell the story of, what has happened to me physically and what the ultimate prognosis is going to be. And believe me, having nursed people who've died from liver cancer, it is quite a horrible way to die. I have regular nightmares. I don't sleep. Maybe if I get an hour or two decent sleep a night, that might be it. The rest of it's just surface sleeping. My body's in constant flight and fright. I suffer night sweats all the time. I'm sure a lot of haemophiliacs will tap into that one. So yes, it's pretty horrible to have that. There's no getting away from this. You wake up with it in the morning, you go to bed with it at night, and it's sitting there with you all the time. Yeah. In 2010, as part of your campaigning, you met with the then Health Minister about the availability of, or lack of availability of counselling and psychological support. Had counselling or psychological support ever been made available to you or to your family? We had a short spell of counselling at the Royal Free, but it was more related to the early years when I was finding it very difficult with Rebecca. Some people have expressed this already, that you affects your brain, you're foggy-brained, you get angry, you get fidgety and very, very difficult. And if you've got a young child, who's having a difficult day and you're physically and mentally not up to it, it's very, very hard to deal with. And in 2010, when you met the Health Minister, you were told that the government would be willing to offer counselling or psychological support to be made available to victims. But you've said that the funding was such a small amount of money, it wouldn't have been adequate to meet the needs of the community, and it was going to have to be through the trusts and funds. Yes, I raised it with Anne Milton, and actually more directly with Rowena Jaycock, who was head of the blood policy team, and asked her, this is quite late in the day, 2010, but knowing that so many haemophiliacs would be suffering with depression and PTSD, and I asked how much money had been set aside at all, because they had announced that they would provide money for counselling, and the sum that was told to me was 300,000 had been set aside for an entire community of patients. And I said, well, that's not going to stretch anywhere near enough. And I said, if someone was to apply for it, I said, how do they get it? Well, they'll have to go through the Hep C Trust. So I said, okay. And I said, and how many sessions, I said, would that actually allow them to have if they were able to secure that? A maximum of 6, I was told. Well, I'm sorry, but, my experience and what's happened to me, I know 6 sessions wouldn't help me one jot. So I don't know what they were thinking about. 300,000 is a drop in the ocean of what really is actually needed.
And in terms of the funds themselves, what's your experience, your direct experience, been of the application process and the information which the Skipton has required applicants such as yourself to provide?
An appalling process, as people have described it, and I've described it this way myself. You're made to feel like a beggar with a bowl. The method and way in which they ask people to apply, the level of intrusive information that they ask of people is a disgrace. They've also set about a divisive process which has set many, people against each other, because one's getting a certain amount of money, the other one's getting another lot, and it's clearly grossly unfair, demeaning and derisory, the sums of money we're talking about here. And the means testing issue is utterly appalling. I said at the outset that and I know a lot of these trusts just weren't meeting the needs of victims, just aren't. And even when they decided, and I wasn't consulted, and I still remain angry about this, some of the longest standing campaigners were left out of a lot of meetings that took place when we were looking at a change in the financial reviews on these trust funds. And I said at the beginning, and I've said it for several years, that it's absolutely shocking that the state is responsible for the multiple infections of a very vulnerable patient group. And I'm sorry, I'm just speaking as someone with haemophilia. It seems to me an absolute disgrace that the state can infect people in this way, spend 3 decades covering it up, and insult us with these pathetic sums of money which in no way could possibly meet or represent the losses that people have suffered. And they are not enough even now for people to get by on. They're the most basic levels. I actually said something in the Department of Health, and it raised a few smirks round the room. But I asked directly in a meeting with Anne Milton and the head of blood policy, who came up with the sum of money that we're talking about. And that was back in, I think, 2011 I asked that question. Who came up with these sums of money? And they couldn't answer me, and I said, well, would you be satisfied in receiving that? If you'd had done to you what I've had done to me, would you be accepting that? I said, because whoever thought these up should be shot. So there was a smirk and a giggle round the room. But I actually meant it, because it is deeply insulting, really insulting and cruel, that people have been, in some cases, pushed into financial penury. Some have not been able to afford to buy their own homes. My worry, my husband here, he won't get a penny from the current trust fund or the previous ones if I die, because he would be means tested, so he wouldn't get anything. I think that's wrong. And the only way you're going to properly help people is to give them proper compensation. We don't want begging bowl funds.
Colette, you've said in your statement, in summary in your statement, this: my life has not been what it is or what it could or should have been because of what has been done to me by the people who were supposed to be caring for me. That's the end of the questions I wanted to ask you. And I think that a number of the themes you raise in your statement, issues about trusts and schemes and so on, are matters that the inquiry will indeed be investigating in due course. But is there anything else before I ask Mr. Steen if there are any further questions that you'd like to say at this stage?
Yes, I just set some thoughts out. If you'll bear with me, I'll read them. I'd just like to say that I do welcome this inquiry as a final opportunity to seek the real truth behind the contaminated blood disaster. And I hope the final outcome will really deliver truth and justice where there has been none, that there will be recognition of the extreme pain, suffering, and an acknowledgement of people's financial losses, which have hugely impacted on my life and that of my family and many others. The damage that's been done to my family life and the relationship with my child, which has taken many years to repair, and we're still trying to get there. And it's my hope, Sir Brian, that you'll relook at Lord Peter Archer's recommendations that he made in his independent report, which I was a witness to, because I think they remain arguably the most comprehensive set of recommendations, and it would be nice to see them implemented as they should have been at that time in 2009 when the report went out. And I think most of us feel, we want every infection that we've been exposed to should be taken into consideration in those recommendations if we're talking about compensation proper. Hepatitis B hasn't been considered here, and certainly there's no word of compensation for being exposed to CJD. We're just talking at the moment about Hep C and HIV. I want to see accountability for lies that have been told by government officials, and even when those lies have been exposed, nothing's been done about them. Those decisions have blocked justice for haemophiliacs for quite some time, and for people who've been infected in other ways. I hope it does become clear in summarising of this inquiry that, as more people give evidence that this was not a medical accident, it was largely avoidable. And I want assurances too that, certainly from government, that long-standing campaigners won't be blocked and left out of meetings as we have been, because that's had a very serious impact. And it's certainly not a democratic process if you exclude people, that should be there and part of discussions. Because obviously it's affected the way that the new payment schemes in financial trusts were folded, and I'm referring particularly to the McFarlane Trust was set up under a legal framework, and people signed to that, and it was meant to be for life, and widows were not meant to be means tested, but that is happening, and it's happening in the new scheme. I want financial security for my husband if I die, because this new announcement with EBS, victims are furious about means testing, but as I said, under the current rules, Steve won't get a penny for the loss of my life. And there's too many anomalies across the devolved governments, which is shocking, because if I'd remained living in Scotland, for example, I would have been entitled to that scheme, plus my husband would have got 75% of that payout if I lost my life. That's not the case here. And finally, I'd say that as a victim of the worst treatment disaster in the history of the NHS, I want to say to every successive government, past and present, and to the current parliamentarians, that you had and still have the responsibility to ensure justice for every person who has been afflicted and bereaved by a life-threatening treatment supplied by the state. And I think we're talking about, as far as I'm aware, over 2,500 haemophiliacs have lost their lives. And those of us who are left still battling every day with the physical and the mental damage of being infected with multiple viruses and having to fight for scraps of ex gratia payments. I want my pain and suffering recognised, and it's so stressful, because that delay in getting justice is compounded by the anger and the disgust that I feel for those who've been complicit in covering up this blood scandal. And I would say too, finally, that it's deeply, deeply upsetting to me that I have in Dublin, both of whom were paid out over 20 years ago by a government who, without any admission of liability, did accept that they had to recognise the pain and the hardship that were inflicted upon victims. So I would say one thing: why is my life worth so much less here in the United Kingdom than in ERA? That's not right.
Thank you, Colette. I'm just going to turn my back and ask Mr. Steen if there are any questions. No, nothing further. So.
I have nothing of my own to ask. Just let me thank you for what you said to us this afternoon, for being here to give your evidence and to tell us what you have.
Thank you.
Thank you very much.
Thank you.
And I omitted to, but I should have thanked Stephen as well. Well, we now take a break for the next week until the Tuesday after next, when we reassemble in Belfast.
So that's right. We resume our hearings in Belfast on the 21st of May.
And we will not be back here in Fleetbank House until the 4th of June. If anyone wishes to follow the Belfast hearings, it will be for the 4 days beginning the 21st, after which there's another short break. Then they can do so following the live streaming if they're not there in person. They are, of course, very welcome to be there in person, but I suspect that most of you will be following online and by getting the transcripts in due course. Thank you very much.
Thank you, sir.